Oh,
All right. Let's go ahead and call the Finance Committee of the Cook County Health and Hospital System to order. I probably stepped on you, Debbie, as I was doing my thing with Commissioner Deere, like I do every month.
or maybe I stepped on you. I apologize.
No, that's all right. Debbie, do we have any public comment?
No, we did not receive any.
Great. Just give me 1 second. Sorry, while I'm starting the meeting, I'm also trying to switch devices, which probably is not very efficient. Again, welcome everybody. Meetings of the Board of Directors of Cook County Health and Hospital System and committees are expected to be held remotely. So pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. And we intend to combine all those action items into one combined motion. So only one roll call vote will be needed during the meeting. We're going to next go to our Finance Committee meeting minutes from January 20th, 2022. These minutes were approved by the board at the January meeting, the full board, but are being presented for the committee's review and discussion if necessary. And I'm now going to ask if there are any corrections or revisions to the minutes. Any corrections or revisions to the minutes? Any corrections or revisions? Hearing none, this will be one of the items that we will put to the aforementioned joint combined motion at the end of the meeting for roll call votes. And moving right along, I'd like to next go to our Chief Procurement Officer, Charles Jones, who's going to first report on 28 contract and procurement items. Charles?
Yes, good morning. Charles Jones, Chief Procurement Officer, Cook County Health. Before you today, as Chair Ryder said, is 28 contracts for your review and consideration and approval. Of the 28, all 28 require responsive letters from the Office of Contract Compliance. We have 21 responsive letters back, so there's 7 outstanding. Looking at request number 1, this is a request to increase the contract with Via Workforce Solution, LLC, which was formerly Vision, Inc., for contract labor management and nurse registry services, $64.1 million for this fiscal year, FY22. This is to supplement staff at CCH to provide quality of care to our patients. Now I'd like to ask that Dr. Bina Peters, the Chief Nursing Officer, have any comments on this particular contract?
Good morning, Board of Directors. Bina Peters, the Chief Nursing Executive for Cook County Health System. This is the Vizient/Via contract is presented to the board for increase due to the following reason. Vizient is the agency who primarily manages all the nursing agencies across the system. And the reason for this request is 3. 1, agency contract, the average hourly rate for an agency nurse increased from approximately $90 an hour when we initiated this contract in 2020, and today we are paying anywhere between $200 to $215 an hour, which is over a 220% increase. Number two, we are also using this contract to manage the COVID and Omicron resurgence. Recently, we onboarded our nurses to Cermak, Provident, and also Stroger to support the increased census and the patient care. Third, we are also using this contract to manage or support the vacancies as a temporary solution while we are actively recruiting all the nursing positions to avoid or even to decrease the agency cost. And currently, we have over 700 nursing vacancies across the system. So that's the reason why we are asking board to consider this request.
So, Bina, we've had Dr. Peters. We've had a number of staffing contracts related to nursing that have been brought up before the finance committee and then approved by the full board over the last several months. And we've attributed very different reasons that, we're not staffed up yet. This is for the surge. These are for the other things that we, are dealing with at this very extraordinary time. But we have made a serious commitment to filling and doing whatever we can and ramping up to fill nurse vacancies. And I just want to make sure that we explain to the committee and to the members of the public that are listening, like how this fits into all that, and how those other contracts fit into all this. So, because we to the casual outsider, we just have a drumbeat of nurse agency contracts, coming through, while we're also saying that we're looking to hire full-time nurses on staff.
Yeah, Dr. Ryder, let me, I can explain the contract that came to the board, and then I will invite Mr. Amos to join me to share the hiring plan. So the nursing brought in two other contracts to the board. One was the Favorite, which is actually an IEMA contract, and the Favorite nursing primarily supported the vaccination efforts across the system. And we used that contract to stand up the mass vaccination centers and also the mass vaccination efforts across the system. We also used that contract to really, during the acute COVID surge place, to open the extra space for ICUs. The second contract brought to the board was cross country. When we needed to onboard over 700 nurses to really merely manage the COVID resurgency, and the VIA was not able to meet all the demands. So we had to reach out to this cross country to really support only the COVID resurgence. So that way, within like 2 to 3 weeks, we were able to onboard around 150 nurses. And that's why this particular cross country contract came to the board to support, the COVID resurgence. And also the cross-country contract include not only just nursing, they had all the clinical care providers like respiratory therapists, social workers, and radiology and other technicians. So that's a comprehensive contract, which include nursing. And our goal is to really, use the VIA once we come out of this COVID to really as a sole source while we are actively recruiting all the positions. So if you have no questions, I would like to invite Ms. Amos to share the hiring plan. And we are working very closely on a daily basis to come up with a strategy.
Great. Good morning, Chairman Ryder and the rest of the board. This is Valerie Amos, Chief Human Resources Officer. As Dr. Peters mentioned, it sounds like this contract has been in place since 2020. So although it predates me, I know that definitely we have significant vacancies at Cook County Health that we have been attempting to decrease with a number of strategies. I have mentioned some of these strategies at previous board meetings, but just to recap, we are certainly working on improving the recruitment effectiveness by redesigning our recruitment process, although that takes time. We do have a consulting company that has been working with us for 2 weeks to identify where we have had some inefficiencies, and so they are looking to help us optimize what we do within the HR space. In addition to that, I've mentioned to the board that we have been under-resourced as an HR team. We have leveraged contractual staff, so former individuals who have worked in the HR space here at Cook County Health have offered to assist us, and we've accepted that offer, as well as identified some other contract individuals who have been helping us. And the third support personnel will be the recruitment process outsourcing. So that's where we have leveraged and established a partnership with an outside agency to assist us with recruiting a subset of positions, because we do know that we need a big splash. What we do within HR is incremental. Those hires are coming, but it's a little too slow for the backlog of positions that we have vacant. So what can we do to optimize that? We have a multifaceted approach with the RPO, the recruitment process outsourcing, that will be starting within the next 2 weeks. The contract is on the final edge of being signed, I think, by Mr. Rocha. But certainly, we are excited to have some support there. We have also leveraged the recruitment events. We've held interviewing blitzes for nursing, partnered with Dr. Peters and her team for 2 job fairs that produced over 50 hires, and we continue to schedule more of those. So those are some of the strategies. As you know, this market is very tight. I don't have to reiterate some of the stats that most of you have already heard. It's public, it's in the media, it's everywhere. So we are one of the many organizations that are truly working through this national shortage. We are very committed to ensuring that we stand up the right types of recruitment events, so that we can certainly improve our brand and ensure that we have an attraction feature. Questions?
Any questions for Val? Or it looks like Joe Harrington has a question.
I really don't have a question, but it's more of a comment. I think that our problem right now is exacerbated not only by, probably the number of nurses that are leaving either the profession or going to work at registries. And so, and you don't have to speak about it now, but my question really is, what are we doing around retention of the nurses we currently have? And are there some things we can do to try to keep more nurses from leaving than are currently doing so?
I can make a comment on it. That is on the top of the priority for nursing and HR. So we do have a retention committee that started, where include frontline staff, the leaders, to really understand the why. We are also looking at some of the best practices across the system, across the country, where other systems are offering sign-on bonuses and all those things. So we do have an opportunity to really look at not only recruitment and also really retention strategy. So that work already is in motion. And we're also looking at our turnover rate to see where we are. And as you said, many nurses are moving to registry work. And the recent data shows that the 211% of the staffs who are actually looking to work within the registry or contract agency due to the attractive compensation. So we have multiple challenges, but we are pulling all those information together to see what we can do to really place Cook County Health System to attract more nurses to support our mission.
And I would just like to add, in addition, the resignation/retirement rates. This organization has a very strong tenured employee base, and so a number of the resignations/retirements that have been happening, that also has has truly proven to be, a challenge for us. But I think that that's why we need to employ a multifaceted approach to really support our endeavors to attract more talent to the organization. In addition to the retention program that Dr. Peters mentioned, we have also hired a chief experience officer, and she has been phenomenal in terms of pulling us together to ensure that there are executive rounds so that we can all see our staff, not only nursing staff, but everyone. Everyone is very important to this organization. And so just meeting and greeting and ensuring that we have that touch point is going to be helpful to not only recognize our employees. We've recognized over 800 employees during the employee anniversary campaign, where everyone received a gift, a meal. And so there are a number of strategies that we need to bring back to the organization, the Thanksgiving meal, those Thankful Thursdays. Just having those touch points will also help not only nursing, but everyone, because we need to keep everyone in the seat here. In addition to that, I've partnered with many of the unions in terms of when there's a recruitment event. So we have been working closely with the NNOC team to ensure that when we have and host events, they are a part of them as well.
Yeah, one other thing that I'll offer, and I see Director Deere has a question. The 34th Annual National Black Nurses Day celebration will take place at Apostolic Faith Church on February the 25th at 6 p.m. And they will have opportunity for people to be present to maybe have a table or something. So if there's interest, someone can contact me and I can maybe put you in touch with somebody that could assist you with that.
That'll be great. Thank you so much.
Mr. Chair. Mr. Chair.
Commissioner Deere.
Thank you so much. I'm wondering, because I was trying to write here, can you reiterate the retention strategy for nurses, as well as what we're doing to attract additional nurses? I got a couple of them down, but I want to make sure I'm right.
So
I believe that directed to Valerie. Yep.
Great. Commissioner Deere, thank you so much for that question. In terms of the attraction feature, we have been partnering with universities and colleges. We also post our positions definitely on all of the social boards. We have developed brand marketing campaigns so that when we host our recruitment events, such as the job fairs, interviewing blitzes, that marketing material is out in the public, not only through the CCH announcements, but also in the communities as well, so that we can attract those individuals. We have also posted jobs on professional job boards, and so we are happy, Mr. Harrington, to partner with the National Black Nurses Association. I am a Black nurse, and so most importantly, we have been attempting, Commissioner Deere, to establish and strengthen relationships. As I understand, prior to 2019, there had not been job fairs here at CCH, and so we want to ensure that we have a calendar of events, not only for nursing, but these contracts are also covering other entities such as respiratory, the laboratories. I mean, there are a number of agency staff here at the organization to supplement while we rebuild and develop stronger attraction features to secure staff, permanent staff. So those are just some of the approaches that we have been utilizing.
Thank you so much. And as a follow-up to that, how are we using, I know you probably recall me asking Charles about this. We have the nurses registry that we have with the GPO. Are we utilizing that innovatively and creatively to attract nurses that potentially we could ultimately get them there and complete the wait time and maybe trickle them over to us? Are we strategically utilizing those vendors?
Absolutely. Go ahead, Dr. Peters. Go ahead.
No, yes, that is also one of our recruitment strategy where the vendors, DPO vendors can bring in nurses, the agency, and then we understand, learn them. Also, they have the full access to all our open positions. So that's also one of the strategy. And there are many nurses personally communicated to me during the rounds. They like us. So they are happy to join after their commitment to, with their particular agency. So that also is a strategy we are using to really recruit. And also we use the frontline staff. And I also partner with an NOC on a monthly basis to talk about a retention plan. And they are also actively participating and recommending frontline staff to be. So different strategy from a retention perspective. Valerie and I am working to really look at our data at the unit level, at the divisional level, to watch the turnover on a quarterly basis. So we can also see if there any intervention we need to do based on the information. So a lot of strategy to build the retention plan.
Thank you so much. Thank you all for what you're doing. This is not easy work. We're in the middle of a pandemic. Well, hopefully we're closer to the end of the pandemic, and we know that it's hard out here. So that's why we have to be creative and use innovative strategies. My last comment is that my hope is that part of the innovation is that if you're using those vendors, we know from the vendors' perspective, not the actual nurses. Obviously, when they bring nurses in, they're making money off of those nurses. So if there's some type of incentive to get to help the vendor nudge the nurses over to us and an incentive for those nurses, I think we would have a lot more progress. If in fact that was the case. We don't want the vendors to feel like we're taking their business away from them, because as a nurse moves from them, then that's affecting their bottom line. And I'm really thinking about those minority vendors in the process. So if we can keep that in mind, I think that would be spectacular. But above that, I want to again say thank you all for doing the job that you're doing. This isn't easy. I'm sure it keeps you up at night. It keeps me up at night, because at the end of the day, if we don't have the nurses we need, we can't get the care that we need. So this is one of those things that I'm thinking about constantly.
Thank you, Dr. Deere. We do appreciate it is challenging, but we are doing it. Thank you.
Thank you.
Absolutely. Thank you. Mr. Chair, I yield back.
Thank you, Director Deere. Are there any other questions? All right, hearing and seeing none. Charles, you want to thank you, Bina and Val. Charles, you want to pick the baton back up and keep running?
Yes, sir. No worries. Request to increase the contract with Vitalant, which is the Institute for Transfusion Medical, ITXM, formerly Life Source, blood products, and Director of Blood Bank, 3.375 FY22 impact for the remainder of the contract period. They will continue to provide blood products and medical management of the blood bank. We are in the process of posting an RFP within the next month for a new award. Request 3, increase the contract with Farm Workers and Landscapers Advisory Project, FLAP, for COVID-19 education and materials distribution. This is for $120,000. This is grant funded as part of the IDPH mass vaccination grants. They will provide both in-person and virtual education sessions to the Latinx population in suburban Cook County and the Mexican consulate. Request 4. This is a request to extend the contract with Bond Carey Medical for custom burn garments for on-site. It's a $0 fiscal impact and a 12-month extension. this contract, a little bit of policy for it. This contract was approved underneath the Office of Supply Chain Management for less than $150,000. We do not need any additional fundings for it, but we also have utilized our authority to extend it without coming to the board. So this now request just for time only requires board approval. Request 5. We're asking you to extend and increase the contract with Jones Lang and LaSalle America for facility support and assessment services, $1.125 million and a 6-month extension. This contract was done in August as an emergency purchase, and now it's brought forward to you for extension. They will continue to provide quality staff and labor for facility director and life safety engineer. Also work on energy optimization assessment and a facility assessment evaluation. Request 6. Extend and increase the contract with SCC Soft Computer for maintenance, software enhancements for software and hardware for the lab information system. $916,000 FY22 impact, $1 million over the 12-month extension. The vendor will continue the provision of system-wide software license and maintenance support and hardware for the clinical laboratories, also existing electronic medical record systems, and will make available through various interfaces for patient care and clinical use. Request 7. Extend and increase the contract with IPA1, doing business as Med1, which is the leasing organization for linen controls and Scrubx machines. $262,000 fiscal 22 impact, $945,000 over the 36 months extension. This is for the provision and upgrades to perform surgical scrub distribution services, maintenance, and web-based software to support Provident, Trojan Provident. We're adding 4 additional units to Provident. Request 8. Extend and increase the contract with Sercom International for telephonic interpreter and document translation services, $170,000 over the 6-month increase. Demand of these services have increased with expansion of the on-call center and expansion of the admissions department. Rated access to interpreter services meets regulatory requirements as well. And we're in the process of doing an RFP within the next month. Request 9. Extend and increase the contract with Dialysis Care Center Management, LLC for peritoneal dialysis nurse staffing, $150,000 and a 6-month extension here. This contract, too, was executed under the Office of Supply Chain Management originally, and now is coming to you for an increase. Back in 2020, the IDPH approved our life-saving home-based dialysis treatment program for patients with end-stage renal dialysis. We've been looking to hire on full-time a nurse for this position, and it's just a very hard position to find. So this company will continue to provide resources while we do active recruitment. 10. Extend and increase the contract with Quicklin and Kiefer, doing business as QLK LLC, executive recruitment, $86,000 FY22 impact, $129,000 over the 12 months extension. Continue the provision of human resources, executive recruitment, and other staffing for CCH. 11. Extend and increase the contract with Dr. Andrew Krunick for dermatology consultants for micrographic surgery in the Mohs Clinic, $100,000 there, 12-month extension. This also is a contract that was done under supply chain management, but the increase now would take it over $150,000, so therefore you see it for approval This would continue service for the MOES programs while we investigate additional resources and capacity to support the dermatology residency training requirements per the Accreditation Council for Graduate Medical Education. 12, amend, extend, and increase the contract with Superior Health Linens for laundry and linen maintenance services. 2.6 million FY22 impact, 6.4 million over the next 24 months. This is execution of the first of two 24-month renewal options of the contract for linen management services for Stroger Providence Hospital, as well as the Core Center that we're participating now in the Blue Light program, which would aid in the reduction of lost linen costs. 13, amend, extend, and increase the contract with ABM Healthcare Support. This is environmental management services, 1.9 million over the 9-month increase. Continue to provide environmental management services at Stroger, Harrison Square, and Central Campus. We're extending the service, and this is leadership, not frontline staffing. We are extending the services to Providence Hospital as well as patient transport. 14, amend, extend, and increase the contract with Allied Universal Services, security services for Providence Hospital and ACHN centers. What's the original scope? $400,000 FY22 impact, $600,000 over the 6-month total over the 6-month extension. Vendor has been providing security service for ACHN health centers and the mass fact sites. Now we are doing additional service at Stroger, and as well, we will, the latter part of this year, we'll go out with an RFP for a new award. 15, amend, extend, and increase the contract with MCG Health LLC, medical necessity guidelines for the medical necessity review, $174,000 FY22 impact, $232,000 over the 12-month extension. This request as well is exercising the second and final renewal option of the contract. They'll provide licensing to evidence-based medical necessity guidelines required by managed care organizations to support the delegation of medical necessity review. 16, amend, extend, and increase the contract with Chrysalis Consultant Group for Crisis Call Center, $149,000 over the 6-month extension. They're continuing maintaining the crisis and referral entry services, call center, crisis, and non-crisis line as required under the MCCN contract agreement. And we are mandated to use this vendor by our state contract. Amend, extend, and increase the contract with Insight Direct USA. This is Palo Alto Internet Firewall Security Mitigation, $112,000 FY22 impact, $149,000 over the total extension of it. Another contract that was done in the Office of Supply Chain Management with less than 150. You're seeing it for the first time for approval. We're beefing up our firewall systems, especially at the Providence Hospital for the data center and to reduce and mitigate external and internal threats. '18 is to execute a new contract with Cricket for kidney care program on behalf of County Care and the health plan services. 2.064 million FY22, 9.7 million over the 36-month period. The vendor will provide proactive population of the health management for members with the early stage kidney disease through and the end-stage renal disease, providing project management, member identification, engagement care, management and delivery, providers network, clinical performance, cost reduction, reporting and analytics this is a contract also will have 2 one-year renewal options. Execute a contract with Milliman Inc. for actuary services, also on behalf of the County Care Health Plan Services, $1.2 million for FY22, $6.6 million over the 36-month contract period. Vendor will perform actuary service for County Care, including reviewing claims data to ensure accuracy of the County Care financial reserves. Contract also has 2 one-year renewal options. 20 is executed contract, one of several that we have here with the Board of Trustees with the University of Illinois. This is neurointerventional clinical services, $222,000 FY22 impact, $890,000 for the 36 months of the contract. They'll furnish an attendant and on-call physician and with qualifications with neurointerventional radiology to provide endovascular neurosurgery and related care at Georgia Hospital. New contract with Olympus America with disposable supplies, surgical supplies on the Department of Surgery, $167,000 FY22, $750,000 not to exceed over the 36-month period. Disposables for endoscopy, GI, ENT, gynecology, and pulmonary. This is to execute a contract with Translogic, doing business as Swiftlog Healthcare, preventative maintenance, hardware and software maintenance for our pneumatic tube systems at Trojan Providence Hospital. I do have a price correction on this. The total not to exceed price over the next 36 months will be $568,884. So I'll work with the board secretary for the correction of this, but $568,884 had a last minute notification of the price here. So this vendor is the original equipment manufacturer of the Swiftlog, the pneumatic tubes at Trojan Providence. We've added Providence to the contract now, plus we've also added a second preventative maintenance as the systems age and stuff. We've added a second preventative maintenance for on a monthly basis. The previous contract was only 1 preventative maintenance per month. Contract does include 1 12-month renewal option. Executed contract with Chestnut Health Systems for evaluation and data collection services, $93,000 FY22, $400,000 over the 60-month 5-year period of this contract, which is grant funded. This vendor is a sub-grantee of the Cook County Health for the U.S. Center for Substance Abuse treatment grant. They'll provide services for medication-assisted treatment and prescription drug opioid addiction, perform setup, contract development, review, development of the project, documentation, development of training materials, and training of the Lighthouse staff, enrollment and setup of the database and the tracking system. The new contract with CDW Government LLC, HIS operations replacement and using computer equipment is a capital purchase for $375,000 as we refresh and beef up, again, change out of our IT infrastructure with newer technology. 25. This request is to execute a contract with Regents of the University of Minnesota to conduct a workforce analysis, $136,000 FY22 impact, $299,000 this grant funded for the 11-month period of the grant. This vendor is a sub-grantee for the IDPH grant. They will do an external assessment, identify gaps in the workforce, and do an internal assessment and provide workforce success in our recruitment and retention, working with the Department of Public Health. For 26, we're executing a contract with the Board of Trustees with U of I, professional consultant support services for Cook County health employees, $200,000 for a 12-month period. They're providing professional consultant services to standardize and streamline our Department of Employee Health Services. '27, again, with University of Illinois, neuropathology attending teachers, teaching and services, $180,000 FY22. They provide attending neuropathology for Georgia Hospital as well as a resident to do other educational functions on behalf of the pathology department. And 28 is a new contract with Medical Consultants Network, doing business as MCN Healthcare. This is the policy management implementation and software. $46,000 FY22 impact, $168,000 over the 36-month period. This is the purchase of a comprehensive policy management software and implementation services. They'll provide professional implementation and training services, customized policy management software, a comprehensive policy library covering all functions within the healthcare environment, and real-time notifications within the system for regulatory changes. That ends my presentation on the 28 contracts. Are there any additional questions?
Any other questions for Charles? Okay, hearing none. Charles, you want to move into the MWBE metrics?
Yes.
By the way, the contracts and procurement items will be added to the group motion at the end of the meeting. Go ahead, Charles. Sorry.
Okay, no worries. Thank you, sir. So here we've added the month of December, for the last board meeting, December 17th, 2021, which basically starts the new fiscal year. So numbers and metrics here and are for the first quarter of the fiscal year. There's 20 contracts you looked at in the month of December. Only 9 of those had contract or specific goals, which basically means that 11 of them had 0 goals, as there was no one certified in the County of Cook or the City of Chicago for those specific functions. Of those 9, 1 contract was a prime award, $3.9 million for 19% of the amount, and 7 were subcontractors for $3.2 million and roughly 16%. So that's about $7.1 million for 35% participation. Unfortunately, even with the contract-specific goals, we had one full waiver, $273,000. That was a contract for the health plan services that offered a software solution for the healthcare measurements and analytical platform. So again, the far right, we started last year tracking year to date and followed the entire year. So obviously these numbers being the first month of the year is just for December. The bar chart, Debbie. And there you see the third bar, 35% for December of contracts that you reviewed, then total fiscal year to date still equals the month of December. Any questions?
Any questions for Charles on the MWBE report? All right. Hearing none. Charles, you want to go to the report on emergency purchases?
Yes. In January, we notified you of an emergency extension to a contract that we had in place with Vision Inc., a 2-month extension to April 31st of this year, while we work out a new contract. This is for safety intelligence software and patient safety organization, the PSO service, $38,000 contract addition. So previously, contract not to exceed was $471,000. We extended underneath the CEO and the CPO's authority to 149. Needed board approval for this 38,000.
Any questions for Charles on the emergency purchases? All right.
Okay. Thank you very much.
We're now
Mr. Chair, Mr. Chair, I just want to take an opportunity to commend Charles. And I know sometimes I'm a pain in the side, but I want to take an opportunity to commend him on making improvements with our MBE reports and the initial reports as well. Charles, I see the improvements that you've done. I've seen your diligence. And so I want to take an opportunity to say thank you to you. I call him like I see him. When you're doing good, I'm going to tell you you're doing good. Not so good, we got to talk about it. And so thank you for the improvement and your diligence in this. I really appreciate you from the bottom of my heart. Thank you, sir.
Sure. Thank you, Commissioner. I appreciate those kind words.
All right, great. Thanks, Charles.
All right, thank you.
We're now going to move to the reports by our Chief Financial Officer, Pam Casara. I believe her first report is regarding our receipt and filing of Cook County Health grant awarded related items. Pam?
Yes, thank you. Good morning, Chair Ryder. Good morning, directors. First up is the receive and file grant awards and renewals, and we do have one new award, the Illinois Department of Healthcare and Family Services for $1,095,000. This is a state transformation project of the West Side Health Equity Collaborative, which is a collaborative of 11 different healthcare organizations that are going to address healthcare disparities. The rest are all renewals and increases that have been previously approved by the board, and I'm happy to answer any questions if there are any.
Any questions for Pam? Okay, Pam.
All right. Next up, we do have a board transfer request this month. Speaking to the item primarily that Dr. Peters, Mr. Jones, and Ms. Amos just spoke to, the bulk of this is transferring dollars from salaries and wages over to registry to be able to cover those contracts that we just spoke about. Any questions there?
Any questions for Pam on the proposed transfer of funds?
Okay.
Hearing none. Pam, you want to get into your year-to-date financials report?
Yes, thank you. So the first month of the new fiscal year started off on a good note. For the month of December, on an accrual basis, we ended with a $15 million positive variance to budget. And on a cash basis, the county showing is coming in at a 49.1 positive variance to budget, primarily due to the timing differences between the way we do our books and they do the books. The highlights on the revenue side, we did have higher than budgeted inpatient volume, so that drove a positive net patient service variance to budget. And that is primarily directly related to the COVID surge that began in December with Omicron. That also caused higher than budgeted volumes on the higher than budgeted volumes also caused higher salaries and wage expense on the expense side, which was offset by lower than budgeted county care claims, which had a positive variance to budget. So county care came in at an 8.7 million gain, and their membership is over the 420,000, which is greater than the 390 that monthly average that we budgeted. So looking at our actual income statement and the variance column, you can see the variances over or under budget, the primary ones I just spoke about, that's creating the 15 million positive variance to budget down at the bottom there. Next slide, Debbie. So here's our patient revenue operating indicators. Again, direct reflection of the Omicron. Everything on the inpatient side there, very strong right out of the gate, 20 and 30% over budget. emergency room visits do continue to lag behind, as we've spoken about in the past, as well as surgeries. And then the ambulatory visits, however, the primary care and specialty care both also well over budget for the month of December. And keeping in mind, too, that December is historically, typically, a lower volume month due to the holidays. But with the Omicron, it was an extremely busy month. Next slide. So these are some of our volume trending graphs that we look at. These are volumes that correlate to each other. Inpatient admissions and the outpatient clinic visits tend to trend closely together in the upper left. And then down in the lower left, you can see some ER visits and ER admits are those lines practically on top of each other. 76% of our admits come through the ER, and you can see directly correlated. Some of the other key stats we tracked, the ratio of inpatient surgeries to total surgeries, and also the observation stays to admissions. Next slide, Debbie. This one is our 2022 charitable and public program expenditure. This reflects the total budgeted and actual spend by the health system beyond the traditional charity and uncompensated care related to the charitable benefits and community programs. Next slide. This one is our hospital-only payer mix pie charts, and this year we are showing it both in terms of charges and in encounters. You can see it does show a different picture when you slice it the different way. You think about the hospital being, could have low count but very high dollar, and the clinic visits, for example, high count and small dollars. So whether you look at it in terms of charges or encounters, it can show a different picture, but we're going to show it both ways this year. Next slide. Our revenue cycle, operating indicators at a glance. We, historically we've talked about red, yellow, green. This year we've rimmed the indicator in red, yellow, or green to quickly identify whether they're meeting goal or not, as well as to be able to see the trend of improvement. The target is the blue line, the actual, the orange. And so we want all of these to be below the blue line, with the exception of cash, of course, which we want to be above. Next slide. And this one is our denial trending, again, outlined in yellow. This one, our new revenue cycle officer has implemented some operational improvements, and what he wants to illustrate here is sort of the pre and post improvement trend. And so he's showing that the orange line, which is his post improvements, the bottom line there, with the hope is will be lower than the gold as the year goes on. And just as an example, I know it may be difficult to see, but if you look at in the right side there and go down to the untimely filing in the pre column, 682,000 in November, 1.4 million in December. And then in the post untimely filing, post improvement, $2,000 November, $37,000 December. And so we'll show this over time. His hope is as they concentrate on the reasons behind the denials, that those trends will improve. Next slide. Here we have either our revenue enhancement or cost savings initiatives for this year. The revenue cycle ones we just sort of spoke to, we did not budget for, but they are occurring. And then we have the ongoing vendor contract negotiations of about 25 million target for this year, and 1/12 through the month of December, we'd expect to be at 8%. We're at 9%, so green on all status here. And the next slide is county care, $8.6 million operating gain, the budget to be at 3.3, and their member months basically are membership right at budget. And then just a reminder, the graph reminder, we budgeted to decline over the course of the year due to the redetermination, but that will not start until at least 60 days post the end of the public health emergency. So at this point, we're looking probably at mid-year before those memberships do start to decline. And then lastly, more care, the last slide. loss of 1.3 million. The budget was to be a 600,000 loss, and that membership does continue to lag behind expectations. And I believe we're going to be coming back next month with a separate presentation and recommendation related to our Medicare membership. And I'll be happy to answer any questions.
Any questions for Pam regarding her financial report? All right. Does not look like we have any questions.
Great, thank you.
Thank you. Moving right along, this is bringing us to the end. And what I would do now is ask for a combined motion to accept item 3A, the January 20th, 2022 Finance Committee meeting minutes. Approve item 4A, contract and procurement items containing request numbers 1 through 28. Subject to completion of review by contract compliance. Receive and file item 5A, the Cook County Health Grant Award related items, and approve item 5B, the proposed transfer of funds. Is there a motion?
So moved. Second.
Motion made and properly seconded. Any further discussion on the motion? Hearing none, will the secretary please call the roll?
Roll call on the combined motion. Aye or nay, Director Deere,
Aye.
Director Harrington,
Aye.
Director Munar,
Aye.
Director Story is absent, and Chair Ryder.
Aye.
You have 4 yeas and 1 absent.
Okay. Great. The next regular meeting of the committee is on Friday, March 18th, 2022 at 9 a.m. I expect that meeting will continue to be remote. With that, we have exhausted the agenda and we are adjourned.